Hello, everybody. I didn't introduce myself as you're going around ahead in the corner. So I'm going to be up here talking for the next few minutes anyway. So I'm Scott Martin with Recovery Friendly Workplace. We're here today to talk about what this is, give you guys some information. And then after we kind of close out, we do have one of our first training classes coming up that will be held here at the Utah Safety Council here in a couple of weeks. So Recovery Friendly Workplace is exactly what it sounds like. It is you want to have a workplace that is recovery friendly. You want to promote people to be healthy. You want to make sure that they have a safe place. So today we have us here from Recovery Friendly Workplace of Utah. We also have USARA. We have Teresa and Evan. They introduced themselves a little bit ago. We are both nonprofit organizations working here with the Safety Council as another nonprofit, trying to achieve the same goal. And really it is saving lives at the end of the day, making sure, people are home safe, making sure that people are well, and if not, providing a place for them. So Teresa's going to get up here in a little bit as soon as I'm finished, and she's going to talk about USARA's role and the National Recovery Friendly Workplace Institute and the certification process. They are the certifying body here in Utah that you can become a certified recovery friendly workplace. And then we'll kind of go into a little bit of the different roles that we're kind of playing here as I talk with what our role is the Recovery Friendly Workplace nonprofit. But first, I want to talk about why recovery friendly workplace is important to me, because I think this has a huge aspect. But before I dive into that, there's one person here. Everybody, Sean introduced himself as we went around. None of you or none of us would be here today if it wasn't for Sean. Sean found out about Recovery Friendly Workplace about almost 3 years ago now, right, Sean? About 3 years, and wanted to bring it to Utah. So none of this would be possible, and nothing that's going on that we talked about today would even be possible without Sean's initiative to try to make Utah a better place. So before we start, everybody, just make sure, let's give Sean a round of applause because he's the reason we're here today. But recovery-friendly workplace and why it's important to me. It's very personal to me. So I've been that guy. I was 25 plus years as an active, silent suffering, very high functioning addict and alcoholic. I was the guy that was high at work all the time, or drunk at work all the time for 25 plus years. Back in March of 2024, we're coming up on 2 years now, I survived my suicide attempt. And that attempt was driven by substance abuse and other life challenges that had come up during that time that kind of pushed me into that state where I thought that there was no other hope. And when that happened, I woke up the next morning and realized that, okay, there's definitely an issue. There's definitely something going on here. I need help. And that was the first point of me acknowledging that I had this problem. I'd been sober, little stints back and forth over the last 25 years. I actually had been sober from alcohol for almost 7 years at that point. But when I realized if I do this, I needed to find something different. I subbed out treatment centers, different things, found one that was going to work for me. At this point in time, my work had no idea what was going on. Never said anything. My performance wasn't great, but they really didn't know kind of what really was going on behind the scenes. So I decided that I needed to go talk to them. I am in the construction industry, as you guys, a lot of you here, so you understand about being safe, how it is, when you acknowledge that you're not being in a safe spot because of your mental health or because of substance abuse, it's time to take action. So I met with our HR director and my direct supervisor, the vice president of the company, and then one of our project managers in a conference room. And I told them what was going on. And we told him that I had decided to go to treatment. This is the avenue I was going to take. But like most of us in this industry, you can't take off work. You have a family to support. And that was my biggest fear, because I wasn't able to support my family. And I had to find a way to be able to support my family, but also take care of myself. So as I was in this conference room, I laid everything out on the table. And the comments I got was, "We're so disappointed in you." And Well, we don't know how to help you. And well, what does this look like? You still want to work here? These are the comments I got from my direct supervisors at one of my lowest points. So that threw up a red flag with me. When I started treatment, what we did is we came up with an idea. I'm always on the road driving all the time. It's not safe to drive a company vehicle, make sure everybody stays safe. So I went and took an office position for the 10 weeks that I was doing my treatment program. But not only just an office position, but they isolated me into the corner. They told me not to talk to anybody. They told me just to stay to myself. Because again, they didn't know how to handle it. And it was very aware to me at this point that something's going on, something's not right. Well, 2 weeks into my treatment, we lost another coworker to suicide due to substance abuse. That one hurt. That one really hit hard, and that really made me think that I'm doing the right thing. I'm trying to get myself better. But then it was like another red flag. Okay, there's a problem. The very next week, we lost another person in the industry to suicide. That one wasn't directly related to substance abuse, as we know, but definitely mental health issues and stuff that were a factor. So at that point, I'm like, there is a serious problem here, and I had no idea the magnitude of the suicide rates and the substance abuse and mental health in our blue collar world, in our construction, manufacturing, all that, warehousing. So I was still in the middle of trying to get myself better. I knew I couldn't take anything else on. So I tabled the idea and said, look, I need to come back to this because there's definitely something here, but I can't do it right now. I don't have the capacity. So I got through my treatment and got my keys back to my truck, started working, and then we started researching, and I found out that, wow, construction and mining are the two highest suicide rates in industries in the country. They're the two highest substance abuse industries in the country. It was eye-opening to me. I really was naive. I didn't know. And so once we kind of found that out, I'm like, we got to do something. And I didn't know what. Me and my wife, awareness is the biggest thing that you can do. And if you can't do anything else, it's talking about it, making awareness. And so we started a podcast. We started sharing our stories. We started sharing stories of other people in the industry and different things. Once that happened, things evolved. And I started meeting people like John, and ran into Sean at an event that I was teaching a suicide prevention course and also spoke at. And that started this wheel of Sean came and told me about recovery friendly workplace. And I'm like, this is exactly what the state needs. This is exactly what our industry needs. And I was immediately on board. It's a fantastic program. But before we kind of dive into that, let's go into statistics really fast because, it's nice to kind of know what we're talking about. It's 47.8 million people, or 17% of the population aged 12 and over, have had substance use disorder in the past year. That's a huge number. These numbers are out of 2022, just so you guys know. 77% of full-time workers have a substance use disorder. They're employed. That number's massive. I had no idea that the numbers were that high. Employers spend an average of $8,817 annually on each employee with untreated SUDs. And that goes into missed time off, safety accidents, all those things go into that type of number. Okay, so there's a few statistics there. 10% of your organization will have a substance use disorder, and only 7% of people with SUD access treatment. Anybody want to know why? Anybody know why only 7% access treatment? Any guesses? Stigma. They're afraid if they say something, they're going to lose their job. They're afraid that they're going to be judged. They're afraid they're going to be isolated in the corner like I was and not allowed to talk to anybody. Okay, let's talk about the impact of substance use disorder really fast. Substance use disorders are among the most common and costly health conditions affecting Americans. And those who use are twice as likely to have been hospitalized in the past 12 months and stayed in the hospital more than twice the duration compared to their peers. I'll vouch for that one. I spent many of nights in the hospital when I was really in it because my body was it was burned out. It was used. And substance abuse disorders, twice as likely to suffer from depression, anxiety compared to your normal peers. it elevates those mental health disorders because it's changing the chemical imbalance in your brain. If anybody wants this, take a picture of this. This is just a calculator that you can use to kind of figure out what is costing you at your place of work. You go to this website here, you'll put in where your facility is, how many employees you have, what industry you're in, and it gives you kind of a breakdown to kind of open things up. So it's kind of a cool little tool that I didn't know it existed until Sean introduced me to it. Everybody got that wanted that? Okay, addiction worsens mental health issues. Very, very true. Anxiety disorders, mood disorders, psychotic disorders, and eating disorders all can stem from addiction. Because again, you're changing the chemical imbalance in your body when you're using substances. You're not going to function properly. Additional considerations, just to go through these. Impact on relationships and social life. How many in here have been affected by somebody close to them with substance abuse? What happens when they're using? Stresses everybody else out. They isolate. Their social life shrinks. It's only the people who are using with them that they tend to hang out with. They don't want to be out in the open, out in public. Okay, financial and legal consequences. There's a lot to this right here. One, you're spending all your money on your substance, so you're not paying your bills. Two, you get legal consequences. You get in trouble with the law. You have to pay for lawyers. You have to pay fines. You have to pay fees. I mean, it's just a snowball effect. Like I mentioned with me, I was one of the lucky ones that I was a high functioning addict. I stayed away from the law. I was just one of those lucky ones. It could have turned the table like that though. But it did put me in financial despair. Occupational growth and hindrance. Addiction and mental health issues impacting personal growth within a company. If you're having a mental health issue, if you're struggling with substance abuse or alcohol, you're not going to advance at your place of business. One, you're losing the desire to learn. Two, you're just there to collect a paycheck at that point because you're looking for what's going on next, what's coming up next. So definitely hindrances as you grow as a human being. I mean, that's what we want to do as humans, right? If we haven't learned something in the day, then we're just being stagnant. So we want to try to learn something every day. When you're in the middle of these issues, you don't have the capacity to learn. So recovery-friendly workplace. Definition of recovery-friendly workplace is a place of work in which the employer establishes, maintains, and continually enhances a culture and work environment inclusive and supportive of employees in recovery from or otherwise affected by mental health and substance use disorders. Okay. Any questions on kind of what that stands for? Anybody? Pretty self-explanatory. Okay. So we had stigma mentioned. So recovery-friendly workplace builds awareness and helps with reducing stigma. How we do this? Educational, occupational initiatives, workshops, talks like this one, campaigns to inform the communities about addiction. It is bringing the awareness. It is making this a normal conversation. The more we talk about it, the easier it is to deal with it as a society, the easier it is to deal with it as an employee. Sharing stories of recovery. Like I said, this is the number one way, in my personal opinion, that you can make a difference. If you can share a story about what you've gone through, somebody listening could relate to that. Somebody listening might know somebody who is going through the same thing. You might find something that says, hey, that could help me, or hey, that could help my brother. Sharing your story could save a life if you can explain what you've been through so that somebody else doesn't have to go down that same road. Sometimes we do all have to learn the hard way. I tell my teenage boys that all the time. They have to learn the hard way. But at the same time, sharing your experiences is you're hoping that you can help save a life. You want to highlight your success in your stories, and you want to inspire and normalize seeking help. Like I said, when I finally realized one of the hardest things for me was when I finally asked help. I had to ask for help. It took me 3 days after that incident in March for me to actually speak up and tell my wife what had happened. She had no idea. She was out of town. She didn't know. And so that was a turning point for me. You want to make sure we're amplifying the voice of recovery. Okay. Recovery is possible with every single person. You can do it. Everybody's levels are going to be different, but it is possible. 20.9 million US adults consider themselves in recovery from substance abuse. I like that number. Let's make that number go up. Let's make that number bigger than the other one we talked about earlier. So why the workplace? Anybody? Throw hands. Why is this important in the workplace?
Where we spend all of our time.
Where we spend all of our time. Some people call it our second family.
Yeah.
Some people call it our first family, depending on how much time you spend there. Okay. People spend the bulk of their time at work. Substance abuse use in the workforce is widespread. Like sometimes all the people who are using know the people at work using. Sometimes none of them know. Like I say, I know that my one coworker and friend that did die of suicide because we had conversations the weeks before if he was wondering where he could find stuff. And so he was struggling, and I was the only person he trusted, but I wasn't in a mental state to help him at that point. Unfortunately, we were both in the same bowl. Untreated substance use disorder is extremely costly to employers. Okay. Safety accidents. A lot of you talked about being safe and you want to learn more about safety. But what's more important is you got to make sure that mentally you're ready to go on that job site every day. Having that daily check-in with yourself and having that daily check-in with your coworkers when you're working in these hazardous positions, because the last thing you want to do is if you're running heavy equipment, you don't want a haul truck guy knowing that he's only slept for 2 hours because he was up all night partying and you're out there working with a shovel and you don't want him running over. So it is about normalizing and knowing what's going on. Adopting RFW policies is good for business and good for the employees. It's not only going to help the business be, run better, but it's going to help the employees live a fuller life. And that's what it's all about. You should be going to work so that you can live the life you want. And if you're working for a place that actually cares about you, you're working for a place that providing the education and the tools that you need to succeed, you're going to have a happier life. Recovery-friendly workplace works. It has been around. The idea was conceived back in 2018 in New Hampshire. I'll let Teresa, she'll go in a little bit more of that with the National Institute stuff when she talks. But it's a proven thing. It works. Education, teaching people. This is the way that we can change the stigma. This is the way that we can change our work culture. The employer-initiated treatment is more successful than treatment initiated by friends and family members. Because why? You spend more time at work. You trust the people you work with. If they're there caring about you and they get you into treatment, you're going to be more loyal to them. Your employees are going to want to work there because you help them through their hard time. Sometimes with families, one thing about family is they're affected by the substance abuse and the mental health disorders just as much or more so than the actual person going through it because it's affecting their entire lives. And so sometimes the family needs to go to a different style of treatment and therapy so they can work through it as well. So it's great that employer-initiated treatment is more successful because that's where we spend our time. And then work is one of the most protective and recovery factors for SUD. If you can stay busy and keep your mind, what's the old saying? Idle hands are the devil's playground. So if you're working, you're enjoying your work, you're less likely to slip back into those habits. You've got the support system at work and you've got the support system at home. Much less likely to fall into those bad habits once you get into that recovery state. So sectors most susceptible to SUD, as we said, construction and mining is number one on the list. Manufacturing and warehouse is number two. Hospitality, food service, healthcare, entertainment, transportation, law enforcement, emergency services, and then the finance and high-stress corporate environments. Every industry has this. It's just the industry with most of you here today are the top ones. We see it the most because of the environment they're in. So training, education, and stigma reduction. We want to normalize the conversation. You should be having this conversation on your daily safety meetings. You should be talking about, hey, is everybody okay today? You might know somebody's going through a divorce or somebody's going through hard times. Make sure that they know that you care. Again, we want to share those stories. We want to use first-person language. Use evidence-based curriculum. We're going to talk about a course here. Why we're right here is mental health first aid. It's a foundational course that teaches you about mental health disorders, substance abuse, suicide prevention, and a handful of other very useful skills on how to have a conversation with somebody, how to approach somebody, and signs and different things. We're going to be hosting the first class here at the Utah Safety Council here in a couple of weeks. The information's on the back table. But that course itself has been around for many years. I think it's been in the States. I could say this wrong, but I want to say it was since 2012. And there's huge numbers of businesses that have implemented this training into their workforce about productivity, not missing as much work, happier work environments. But making sure that you're using training that's proven to work, making sure that the training is put together by somebody who understands the workforce and somebody has the background to be able to provide that. The other thing is we've got to make it fun. Nobody wants to sit through an 8-hour training about mental health and substance abuse. I mean, it's not what you wake up and want to say, I want to do that this week. But at the same time, it is something that we need to do. So let's make it enjoyable, let's make it interactive, and let's make it fun. Because when you do that, you're going to get people engaged. You're going to get people interested, and they're going to remember what they needed to remember from that training. So, like I had talked about, Teresa's going to get up here in just a minute and talk about the certification through the National Recovery Friendly Workplace Institute. Before she gets up here, like I say, we're all different parts here after the same goal. And so as I kind of wrap up, I just wanted to go through what our part here as Recovery Friendly Workplace in working with conjunction with USARA and Utah Safety Council is kind of what our mission statement is, so everybody kind of understands what we're really trying to set out to do. I mean, ultimately, one sentence is we're here to save lives. We're here to help. We're here to make everybody go home at the end of the day. But RFW of Utah's mission is to reduce the stigma surrounding substance abuse, suicide, and mental health. Our focus is to provide the training and educational courses to better equip employers with the tools and resources to assist not just management, but all of the employees through their difficult times. Our goal is also to have a mental health champion or peer support advocate on every job site and every division of the company. You need that safe person to go talk to. A lot of the time you want to talk to your direct supervisor. A lot of the time you don't want to go to HR. It's like going to the principal's office, I always joke around about. But you need that safe person to talk. If you have a coworker that you know has been through the training, you have a coworker that you know is a safe person to talk to, you're more likely to ask for help than if you don't have somebody like that. So one part of our mission is to get people trained on every job site so that you can have somebody there that's a safe person that will support you through what you're going through and help you find the information. I mean, how cool would it be? Everybody here, I mean, most of you wear hard hats during the day. You know people who don't know what hard hats are, but hard hat stickers, right? Hard hat stickers are cool. Everybody likes hard hat stickers. How cool would it be that we have hard hat stickers that mean something? This is one that we have here. It says you're a big deal. And it's just reminding you that you mean something. How cool would it be to walk up to somebody and see a mental health first aid hard hat sticker, a suicide prevention hard hat sticker, a substance abuse use training hard hat sticker? That's going to make you feel a little bit more safe. That is our goal. That's kind of part of our vision. RFW of Utah will also help assist, guide, and support employees and their families through challenges with connecting them to resources such as support groups, places like USARA, therapy offices, treatment centers, so that all employees have access to the help that they deserve. We just want to help each other. We want to work with USARA here with their national certification process to get businesses on board to keep them recovery-friendly, workplace safe. So everybody, I thank you for the time. I thank you for the interest in you guys coming out today. I'm going to turn the time over to Teresa. She's going to talk about the National Institute and how that works, what that certification process looks and what it means. And then as soon as she's done, Sean's going to take a couple minutes in the end just to kind of tell everybody why this is so important to him and why he brought it here to Utah. So thanks, everybody. Here's Teresa.
Okay, different logo, same place. We've also rebranded, probably like Utah Safety Council in the past few years. Still USARA. Utah Recovers is just a little bit easier to remember of who we are and what we do. So we are the certifying body for Recovery Friendly Workplace. I'll share a little bit more about USARA first. We're a 501c3 nonprofit organization. Our mission is to connect and inspire communities to advocate for addiction recovery, and we provide non-clinical support services for people in addiction recovery, seeking recovery, maintaining recovery, and also provide programs for family members and friends. We have a low barrier to all of our services, so we're mostly federal and state grant funded, and we want people to be able to enter our space without needing an insurance card or an ID or anything like that. We just want to serve people. So like Scott mentioned, Sean is who brought the concept of Recovery Friendly Workplace to us at USARA as the recovery community organization in Utah. We have 6 centers throughout the state, so we're spread all over Utah. And when he brought the concept to us, we really thought, wow, this fits our mission and how we want to help people in recovery. So the definition, same, recovery friendly workplace, but what it does is it doesn't bring the problem to the workplace. It brings the solution to a problem that already exists. So the stigma and the shame, it's all there, the substance use in workplaces. So we're trying to bring the solution to that problem. Like Scott said, we are a nationally certified recovery friendly workplace. So that means that we got certified ourselves and had to apply to become a certified workplace through the National Recovery Friendly Workplace Institute. It started in 2018 in New Hampshire when Governor Sununu thought this is something that I want New Hampshire to push forward is recovery friendly workplaces. So that's really kind of where it all began. And then the Institute was announced in a formal White House announcement in November 2023. And their goal is to establish, is to expand and formalize the efforts of recovery-friendly workplaces. So ensuring that employers nationally and then those in the different states that don't yet have a recovery-friendly workplace program are supported in building that. Actually, the National Safety Council is certified as well under the National Recovery-Friendly Workplace Institute. So what this looks like is a certification process. Like we said, USARA is about low barrier, so the certification is free and will continue to be, but there are 4 pillars that we have organizations look through to see kind of where you're at when it comes to recovery friendly. Not all employers can have a perfect score of 100 because that's not possible, especially when it comes to safety. There are some things that are mandatory and we understand that, but it just gets you thinking a little bit more about what are things that we could do differently. I think recovery friendly workplace is really about culture, building a safe culture, building trust with your employees. And like everyone has said, the passion that I have for this comes from the fact that we spend so much of our lives at work. So I really want to enjoy the place that I work and want to enjoy my colleagues, and this helps contribute to that. So culture, having a statement about RFW, we say recover loud at USARA. So for organizations to have, you know, a stamp of certification and say we are recovery friendly and we are loud and proud about it, build safety and trust with your employees. Having resource groups, substance-free options at work events, a highly placed ally, someone in leadership who is comfortable sharing their story about their own addiction or mental health and recovery, and support. And we have education and awareness, knowing what your health insurance offers, if it's equitable when it comes to substance use and mental health, similar to physical health, and also educating your employees on how to use their health insurance. There are usually a lot of benefits through health insurance that employees don't know about. So pointing that out, being able for them to use that as a resource. And also having no cost assistance like an EAP that you can direct your employees to if they're looking for support. Then we have hiring, retention, and advancement. So fair chance hiring, return to work support. So if someone does have to leave to go to treatment, that you have a plan, a supportive place and plan for them to return back to work. Proactive recruitment. Are you hiring people in recovery and open to that? And then also flexible work options contribute to a recovery-friendly workplace. And then benefits kind of goes hand in hand with education and awareness, but employee awareness, education on substance use disorders and what recovery means, and then also access to naloxone. Naloxone is very accessible in Utah, and there are trainings through Utah Naloxone or your county. You can get it from the library. So we really want everyone to know how to use naloxone for opioid overdose, to have it with you where you are. Okay, so the roadmap kind of starts with a letter of intent, someone from your organization to say, hey, I want to push this forward with my organization. We'll talk a little bit about the employer and employee resources available, refining the process, going through a readiness assessment, which has all of those pillars to say, what are you doing right now? What could you improve on? Again, not everyone's perfect. I don't think a score of 100 exists for recovery-friendly workplace, but we can push you toward with that. And then promotion, being certified, and then staying the course as well. So our support for employers will be a recovery-friendly workplace toolkit. And do your managers know about the signs of substance use and mental health? And do they know how to talk about it? Do they feel comfortable talking about it? A lot of employees are closest to their supervisor. Do you have a safe workplace environment where they feel they can come if they're struggling? Education, policy and procedures. A lot of the time, policies can kind of put organizations in a box where they say, this is what our policy says, we're no tolerance, so we have to fire you. Where can you be flexible with those policies and procedures? Consultation and also certification and recognition. Like we said, we want everyone to recover out loud. We also want organizations to proudly show that they are recovery workplace friendly. That's the word. And then also for employees, like I said, what USARA provides is recovery support services, your support services to provide one-on-one help. Everyone that we hire is a person in addiction recovery themselves or a family member or friend. I personally have a sister in long-term recovery from addiction, so we're all very close to the cause. A family support program. Family members are left in the dark. There's a lot of isolation and shame. I know that from experiencing my sister's addiction. So the family support program is really about positive communication with your loved one who's struggling. Linkages to care. I view USARA as kind of a resource hub. We have a lot of connections to treatment and therapy and medication assisted treatment and all of the things that people might be looking for. We think that there's no one way to recover. 12-step is very common and AA, but at USARA and everywhere in Utah, there are a lot of different ways to recover, like Recovery Dharma. It's a Buddhist path toward recovery, or SMART, which is more skill-based. So just offering and knowing that there are other ways to recover. There's not just one road to recovery, and supporting that. And then again, overdose prevention and intervention, medication-assisted treatment, and having access to Narcan and naloxone. So that was a quick overview of what the certification is. We have that letter of intent on our website at utahrecovers.org/for-businesses. At business cards right in the back too, if you want to reach out or have more questions about certification. Happy to answer. So yeah, I think that's it for me. Thank you, everyone.
Can I stand here or do I have to stand back there?
So the camera's right there.
Oh, on camera. All right.
You're on camera now.
I'm on camera. All right. Well, thank you. And it's a pleasure to be able to stand in front of you and talk about recovery friendly workplace. So I shared in my introduction, I've been a clinician and somebody that has worked in substance use treatment for about 25 years now. Most of that time, I have worked with employer groups. I've had a lot of leaders of organizations reach out to me and ask for my guidance support when they've had struggles with different challenges that employees or their organization might be facing. So as I've gone about this career and working closely with employer groups, I realized that there's a difference in how we react and treat and support different individuals within our organization. If I was diagnosed with cancer today, what do you think I would do in regards to my employment? What would I do? I'd notify them immediately. Who would I go to?
HR.
I'd probably go to HR. I'd probably talk to my supervisor. And how do you think HR or my supervisor would respond? Sympathy?
How can we help?
Shock? It's on your face. How could we help? A lot of compassion, a lot of empathy, right? However, when it comes to struggles like substance use, what happens? If I'm struggling with substances, I've got an addiction, what am I going to do? Who am I going to talk to? Who am I going to tell? I might desperately want help, but I don't even know where to go to find it. And yet I'm afraid to share or to seek assistance from those people who could potentially help assist me. And so again, there's a difference then in how we navigate our situations within our work environments. If I've got a physical illness, injury, I might share that immediately. And with that, I'm going to get some compassion. I might need some flexibility. I might need to be able to miss work to go get some of my treatments, things like that. As I come back from treatments or as I go through different procedures with my medical process, I'm probably going to get a lot of, hey, how are you? How are you doing? What can we do to support you? How can we be helpful? When it comes to substance use, we don't usually have that. Why don't we have that? Well, in many respects, because there's a lot of stigma associated with it. There's also a fear that if I go and tell HR, what are we afraid might happen? Many of you said, you might be fired. I might be fired for a difficulty. Now, let's use that same example I just shared. If I have cancer and I go tell HR, you think they're going to fire me? That's almost funny, right? And some of you are laughing, like, smile on your face, like, that would be ridiculous. That's totally silly. Yet when it comes to substance use, most organizations, that is the response. A no tolerance policy. We do not tolerate if you use, and if you use, whether that is you have a positive drug test, you have a post-accident drug test, you tell us, whatever that is, that's going to have some impact. Potentially, it's going to take you from your employment. And yet, at the same time, just like that person that might be struggling, myself, I use myself as an example, that might have cancer, I need the support of others. And I might need the support of, hey, here's the resources we have available. I may not even know how our insurance benefit works or what I can get as far as insurance or FMLA or short-term disability, any of those kinds of things. I need some support to go figure that out. In the very same sense, those that are struggling with substance use need support. Again, I said the example might be, I might want help, and I don't know where to go to get it. And I'm afraid to share with anybody. Now, the other thing might also be happening, which is I might share something with HR or a supervisor as suggested, and yet it's to help me with the struggle I'm having with substance use. And what do you think many of them in HR or our supervisors would say? Not about firing. What else do you think they might do or say?
Personal problem.
Personal problem? Yeah, they might say that for sure. They might also, so thank you. They certainly may say that. And they may also say, I don't know what to tell you. Like, I don't know. I don't know where you go. I don't know what you do. And so you might take that risk, and yet you now share with somebody, and they're telling you, I don't know. And so now you walk away going, I should have never done that. I just created a bigger problem for myself because now they know and they didn't give me any assistance or help. So recovery-friendly workplace is all about changing a culture. It's creating an environment that whether I'm struggling with an example of a cancer diagnosis or I've got an addiction I have not been able to beat, I've got an environment around me in that work environment that is able to support and be able to help. And those no tolerance policies hopefully will become less and less because we're going to be able to help people see that, you know what, we can help people overcome these addictions and we can help them get on the path of recovery. Now, this is not about we just take people that are struggling and we just tell them, well, hey, good luck with your using and don't have any access while you're out there. No, we've got to make sure people are safe. And we've got to make sure people are not using, but we want to help them be able to get in the avenues to be able to get on a path and be able to not be using and be in recovery. So we want to know about things. We want to be educated. We want to be trained as leaders and supervisors and HR teams so we can be a resource for good and for help and help them know where they could get support, what they could do. And then we can also create an environment where there may be some flexibility where that person can get their treatment just like somebody else might be able to go get their cancer treatment. And we can then, overall, we can retain that employee, just like we had hoped to be able to do with somebody with cancer that they overcome, they go through the process, their treatments, they're in remission, and they're back being that great employee that they've been. And we would hope that for those people that might be struggling with substance use as well. So we create that culture, and we create that culture by, we talk about it. One of the slides on the presentation was, we talked about it in our stand-up meetings. You don't have to talk about it for long, you just talk about it for a couple of minutes, and people start to go, okay, hey, it's okay, we talk about this stuff around here. We can support each other, we can help each other. Why is work so important in all of this? Because work is one of the greatest protective factors. Many people that are struggling with these types of things have burned bridges in personal relationships. They've lost friendships. They've lost family members. Maybe they, so on and so forth in that. But when it comes to employment, most individuals are like, I can't lose this. And yet on the flip side, if, as we talked about a no tolerance policy, and I tell somebody I'm struggling with this, now I lost my job, you think I'm like, oh, now I'm really going to beat this addiction? No, it's like, no, it's just worse. It's like the one thing that I wanted to be able to help and be able to be sober for was my job, and now I don't even have that. Not only do I not have that, I also don't have the resources that my job provided so that I could get help. And so now what's the point? And I think that's often the response. What's the point now? I just lost the one being that. So that employment is critical in helping somebody say, I'm going to be able to succeed with this because I don't want to lose that. That's my livelihood. That's my self-esteem. That's my family. That's everything is tied into that. So that's where recovery friendly workplace becomes. So we create a culture. We go through trainings. We create an environment that is supportive of people of any type of difficulty or struggle. And by doing that, of any kind of difficulty or struggle, we can be as helpful for the person that's dealing with cancer as we can be with the person that's dealing with an addiction. And we can help them maintain their employment and be able to be those successful individuals, not only in that work environment that we want them to be, but also in their personal lives outside of work. So that, in summary, is why when I learned about recovery friendly workplace about 3 years ago, I said, you know what? We need this in Utah just like it's needed everywhere else. And the fact that it's not here in Utah, well, let's do something about that. And I know about it, so I'm going to share a little bit and get some support and see what we can do to bring this to Utah. So here we are. We're in the very beginning stages of all this. And we appreciate your interest in learning about it. But there's a lot going on, and there's a lot of things that over the coming months may have some impact on what all this looks like. But at the end of the day, most importantly, is we're going to have resources, support, programs, create a culture that over time we'll be able to be as open about and supportive of those that are struggling with substance use as we would be of those that are struggling with medical conditions. So again, thank you. And hopefully we will, we will continue to move this forward and have it really make a difference in the lives of, I think, all of us, because all of us have a connection to what this is truly all about. So thank you.
Well, everybody, that's what we have for you today. I know a few of us have time. We'll stick around, answer any questions you guys have about anything that we've talked about today. You can also reach out to us. Again, just to hit it, we will be offering and starting some of the training classes here at the Utah Safety Council. The first one's on the March 5th. Is that correct? March 5th and 6th. And that is the foundational course, Mental Health First Aid. It's 2 half-day courses, so you can sign up. The QR code's on the back there. And again, tell all your friends and family about this. Everybody has a job. Everybody wants to be safe. There's lots of opportunity here for us to change this culture over the next few years. It's going to take time. This is not an overnight thing, like Sean said. So again, thank you all for attending today. We appreciate your interest and the opportunity to talk to you today.